Hello everyone, welcome to InspireLifePT.com. I'm Dr. Emily Kubat, and today we're going to be doing exercises for post-breast surgery weeks 3 through 6. So by now you should have any drains out that you might have had in, be out of that inflammatory phase. That's the first couple weeks, and things should really be starting to heal for you, and hopefully you're starting to feel a little bit better. So if those exercises and stretches that you were doing those first couple weeks are getting too easy, I have a couple more to progress to. And then also, if you're still having a little bit of challenge with your mobility, I have a couple others that are pretty easy and can kind of help you get along on your way. So let's get started. So almost everybody's favorite exercise is with an exercise ball. This one is just a 65 centimeter ball from the dollar store. They also have one bigger, a 75 centimeter, and that one honestly works the best for these exercises, but the smaller one will work as well. So what you can do is kind of straddle the ball here and come forward, get a good stretch, hold for about 10 seconds, come back, and the bounciness of the ball is kind of nice to help out with that. And then you can go ahead and come to the side a little bit and to the other side. Just nice and gentle, good stretch. This gets down the side of your chest and your arm a little bit more. And then if you are more mobile and feel like you need a better stretch, you can also come down to the floor here and do like on your knees and stretch out. All the same things. And then you can also, if it's harder for you to get down or even sit down, you can also put it on top of a surface, on top of a bed, and kind of roll forward too. But it's almost everybody's favorite. Gives you a good shoulder stretch, arm stretch, and a back stretch too. So for the next exercise with this ball, you can go ahead and set it up next to you. Now some people might not be able to do this right away, so if you can get your arm up this far, then you're good to go for this exercise. But if not, you'll get there and you can do this one later on. But putting your arm up on the side of the ball, your thumb up, and then you just kind of roll towards it a little bit. Feel a nice strong stretch in here. A little bit of discomfort, but not too much pain. Hold for about 10 seconds and then roll back. And you can just continue this one about 10 times. And you can kind of adjust the position of where your arm is on the ball to make the stretch feel the best for you. And obviously, if both sides are tight, you can do it on both sides. Otherwise, just on the arm on the side you had surgery on. So the next one I want to do is called the wall wash. How some people do it is they do the wall walk, but I prefer to have your full hand on the wall and have a little bit more support. So you can go ahead, take your surgical side, and just kind of wash up the wall there. When you get to a pretty good stretch, hold it about 10 seconds, take some nice deep breaths, try to expand your chest, hold it up there, and then bring it back down. And you can do that about 10 times, holding it for about 10 seconds when you're up at the top there. And if you had surgery on both sides, you can do both sides, or you can just see with your normal side versus your surgical side where you're kind of trying to get. Now, if you get way to the top and you're not feeling a good stretch, you can go ahead and step a little bit closer to the wall so you can get it a little higher, or you can even move to the doorway. We'll show that in a later video that's a little more advanced, but you can move and get closer, be in the doorway if you don't have a wall available. And then for working on your motion out to the side, you can go ahead and come up the wall out to the side. Usually this one is quite a bit more challenging for patients, so you don't necessarily expect to go quite as high as when you're up front, but you can do the same. And then if this gets too easy, same, you take a step closer to the wall to really feel that pull. But it should be a pretty strong pull in your armpit area, not too uncomfortable. And it should subside pretty quickly when you bring it back down. So another exercise that we did last time in the lying down position, you can bring your arms up and do our butterfly wings. Just like this, bring them together, bring them back out, If this is uncomfortable for you to do in the sitting position, you can continue to do it in the lying down position where you have a little more support from your pillows. But just continue to do it like this. Really feel that stretch in your chest, across the front of your shoulders. You can do about 10 of them and just hold for a few seconds when you're out there. Okay, so these next couple ones are if you're having a difficult time with mobility. So if you're having a difficult time, say just raising your arms up like this, doing any of the ones on the wall that we just did, this will give you something that makes it a little bit easier. So you're gonna need some type of pole. So this is a painting stick from a paint roller. You can go ahead and get a dowel if you have a cane laying around. Broom handle, anything like that will work. So you're gonna go ahead and lay down and you take both hands on it like this. You can just kind of evenly space them about shoulder width apart, and you are going to lead with the arm that you did not have surgery on, so your normal arm. So I'm gonna say in this case that that's my right arm. And the other arm, my left arm, that I had, the side I had surgery on, is just gonna be along for the ride. So you can go ahead and extend your arms out and just slowly bring them up. Your surgical side is going to be as limp and as heavy as it can be, and the other side is gonna be doing all the work. And you just go up until you feel a stretch, hold it for a few seconds, and then come slowly back down. And then you can just continue that. So as a reminder, surgical side is limp, not really doing much of the work. This right side is the side that you didn't have surgery on is the one that's gonna help bring that through. That just makes it easier. It takes the muscle work out of it for the surgical shoulder, and helps it to just relax a little bit and get that mobility back before you start using the muscles a little bit more. Another one that's a little bit easier laying on the bed, you can kind of take your arms out to the side and you're just gonna make like a snow angel and just kind of relax your arms like this. Go up as far as you can, stretching, and then come back down. And if you can't make it up that far, that's fine. If it just feels good to even just rest your arms out like this, that's fine too. Sometimes that's enough of a stretch for people. But if you can kind of slowly bring them up, even if you can just bring them up a little bit, you bring them up and just let them go there. So those are some other ideas for you if some of the other exercises are hard. So hopefully some of those exercises and stretches were beneficial for you to see and will help you keep your mobility. Just a couple things to keep in mind when you are doing the stretches. You might have a little discomfort, feel a pretty strong stretching feeling, but nothing should really be painful. And as soon as you stop doing the stretch, all of those stretching and discomfort feelings should subside. I don't want you to do anything where you're sore the next day. These should be things that you will be able to complete each and every day. Don't feel like you have to do all of them every day, but pick a couple so that you can keep your mobility going. So make sure you follow us on Facebook, YouTube, and InspireLifePT.com.